What happens in the brain of autistic individuals who are nonverbal? This is what we're going to look at. So the language center disturbance in the brain is shown as abnormality and lack of activity shaded in the blue area. So these are typically language center. As you can see, the lack of activity is related to circuit connectivity problems. And the diagram showed here, this is a brain of a neurotypical person, and the language circuit is actually pretty widespread, medial geniculate nucleus, and so on. The prefrontal going to the prefrontal cortex, depending on what is being disturbed. In my clinic, we can actually look into these circuit disturbance. And what has been found in ASD or autism spectrum disorder children is that there is an overgrowth of the brain. The overgrowth is in the form of both gray and white matter. And in fact, there are 67% more prefrontal neurons. What happens with the overgrowth is, over time, this is the growth curve of a normal, not typically developing child, and this is the ASD child. So with the overgrowth, what happens is that the neurotransmission is affected. So think of a traffic jam. Having more neurons doesn't necessarily mean better. It can slow down the rate of neurotransmission. It can affect growth process as the child matures and more complex function is needed. And there could be possible decline and degeneration as well. So early decline. And these are some of the reasons that can contribute to lack of speech development. This is the fiber thickness. And this is a DTI, diffusion tensor image. And the thicker the fibers, the more myelination and faster the transmission of information. What happened in autism is that there is a drastic reduction in fiber thickness. As a result, transmission slows down. Therefore, it's very important for us when we are helping ASD children develop speech is not to expect them to speak at the same rate as a neurotypical. Slow down your speech, give them space to be able to process and answer you back. So the high-speed connection is seen, marked as the lateral prefrontal cortex, as you can see, connecting the lateral to the frontal posterior, to the language area in Broca, as well as in the ventromedial and prefrontal cortex. And this is one of the reasons that a nonverbal ASD individual lack fluency. And typically you can see that their speech does not happen smoothly. So they may have a word here and a word there, and maybe interspersed by a lot of empty space and time. It's because the lack of transmission and connectivity in the brain. So what can be done? Can this situation be improved? And this is, again, a brain imaging image. Before intervention, you can see the Broca area. The Broca area is the speech center, is responsible for speech production. And after intervention, much more area of the brain is active. So the brain is working hard, and you can see more areas of the brain being active. which is good because you are recruiting other centers to help with speech. And this is a QEEG brain image from an ASD individual in my clinic. As you can see, before intervention, there is abnormally elevated activity in the orbital frontal cortex and suggesting a lot of anxiety, a lot of conflict, and a lot of sensory activation, as well as physical activation, hence the anxiety, the emotional outburst that we talked about. After intervention, all the red elevated activity has subsided, and this child has calmed down. And in fact, in our clinic, this child has obtained functional communication training, is able to use the words effectively, to the point, to the situation. This is an example of a typically developing child or a normal control on the left. This is a child with autism. Note a lot of amplitude asymmetry aberration, suggesting difficulty with neurotransmission, as we have seen. Note coherence abnormality, which means difficulty with comprehension, especially comprehension of what has been told, receptive language, not only speech and communication. And this is what happened after intervention. Note the alleviation of neurotransmission error. And in fact, this is predicted IQ before intervention in our clinic. And you can see a 20 points IQ increase after intervention. Does it mean that the child just all of a sudden gets smarter in a year? Not necessarily. What that means is because the child has calmed down enough and is more receptive to learning and more able to use what he or she has learned, you can see that the efficiency of the brain has improved. So this is another example of a child before intervention. Lots of the area of the brain is blue, shut down, not active because of the traffic jam situation that I have shown you with the overgrowth. Many ASD individuals do not know how to use their brain. As a result, you see this profile: under usage, under activity. After calming down and after systematic treatment process, the blue has subsided, and this child is more amenable to direction, training, and obviously achievement of the training goals. You can see that. So before intervention, as you can see from the brain and from the behavior, there are lots of behavior suggesting withdrawal, refusal, lack of engagement in life. After the intervention, normalization, after the brain has normalized, the client is more willing to try new things, to participate in life skills, activity, to learn, and ultimately even to read. So it is possible. Again, you see with this client an improvement in the predicted IQ score from 100 to 180. So it is promising with the intervention, with systematic training. You can see that the deficit that is presented at birth can be ameliorated, and other areas of the brain can collaborate and participate. And especially when the client calms down, and is more compliant, we will be able to see gains. We have seen tremendous gains, and we have taken many nonverbal, minimally echoic individuals to being able to speak functionally. This is quite exciting, and we would like to urge parents and caregivers to give it a try.